Cloud Excellence. So, good evening, everyone. I am so excited to see you all. This is the last day of APHA. I hope you had a phenomenal conference. We absolutely had a phenomenal session this year. I want to welcome you to our CHPPD Awards Recognition and Social Hour. Thank you so much for taking the time out, whether you're in person in Denver or virtually. I come to you from Atlanta, Georgia, and I'm just so excited to see each and every one of you today. And I will say we have, in true fashion, a pretty jam-packed agenda because we always have so much to share, right? So what we're going to do is take a few moments to do a welcome and an icebreaker. We're going to get into some highlights from 2021 because guess what? We did a lot. And I'm sure that some of our CHPPD leadership can share with you all the wonderful things that we've done in this program year. I actually want to highlight as well the activities that we had during the annual meeting because we were busy, but we had some phenomenal programming for you all, and we want to give an opportunity to share and give some highlights from that. From there, we're going to go into our awards recognition ceremony. So we'll be sharing awards from our coveted Bloom Award for Excellence in Health Planning, our Vision Award, our doctoral and master's student abstract awards. We also have a very special presentation of members who serve in the throes of the pandemic. And so we want to take a few moments to acknowledge those persons and to tell them thank you so much for all of their hard work. We do recognize that during this pandemic, it was a lot on all of us. And so we want to take time to reflect. A lot of great things have happened, in spite of the not so great things. And we want to take a moment to celebrate everyone. And then we also want to celebrate the accomplishments of our section members as they make their mark on our organization. We've come away this meeting with some great wins, and I'm so excited to share that with you all. And then we're going to end our night with a little social networking activity. It's always good to be able to connect with one another. It's 5 o'clock somewhere, so if you need to go get your adult beverage, get your snacks, please do so. We welcome it. We encourage it. It's a family. And again, we're just happy to share this moment with you. So to start us off, again, welcome to the 149th annual meeting from Denver, affectionately known as the Mile House City. I absolutely love Denver. I swear, I tell everybody Denver has the best water in the world and the best air in the world. It's an absolutely beautiful city. So for those who had the pleasure of attending in person, I hope you had an opportunity to step away from the convention center and really take in the city. It has a lot to offer. Again, my name is Ebony Johnson, and I am so honored to serve as your host and as your chair for this amazing section. We cover a broad spectrum of public health. And as you see tonight, you'll get an opportunity to see some of the amazing work that some of our section members do, not only in their fields of public health, but their contributions to our section in this organization. So what I like to do is just take a few moments to just say hello. Let us know what your name is, what your preferred pronouns are, what section of the country or the globe you come from, and your organization. So if we can go ahead and start typing that in the chat, our friend Emily here is going to be monitoring our chat room, and she'll give us a report out of where you're representing. And again, I say hello from the beautiful city of Atlanta, Georgia.
I'll go. Hi, everybody. My name is Deja Knight. I'm a second-year doctoral student at Johns Hopkins Bloomberg School of Public Health. And I was in Denver in person. Now I'm coming from you from the Bay Area of California. So it's very nice to meet you guys and to see you lovely faces.
I can go next. My name is Keely Trujillo, and my pronouns are she and her. I live in Durango, Colorado, and right now I'm currently a student at Fort Lewis College, and I'm joining to show recognition to my teacher, Dr. Duda, and she's going to be accepting her award today, so I'm really excited for her today.
Hey everyone, Maurice Johnson, Chair-elect and in the DC metro area, and welcome to everyone here. His and him. I am a student at George Mason and a research consultant at West Ed.
And I know in the chat, we have folks representing Dallas, Texas. We have individuals representing North Carolina, Chicago, Illinois. Absolutely love Chicago. I eat my way and shop my way through Chicago every time I'm there. Again, we have other representation from Maryland, Colorado, North Dakota. So nice to see you, North Dakota, in the house. We have Richmond, California, Albuquerque, New Mexico, Pittsburgh, some other Illinois from Drexel representing, Los Angeles is representing. Always good to see other folks from Atlanta. So yes, we have a very cross section of folks. I'm so excited to see people from all across our country. So thank you guys again for joining us. Anyone else that wants to take a few moments just to introduce yourselves, I'll go ahead and open up the floor.
I'll just do it quickly. I'm first going to apologize that I look like a sweaty mess. I just taught a dance class. So, but hi, Caitlin Esposito, she, hers. I am the membership co-chair right now for CHPPD. I work for Bobby Jones, Chiari, and Sringamalia Foundation, which is a big, long, ugly way of just saying brain and spinal cord disorders. It's much easier. Patient advocacy organization. And I am really happy to be here. Did I do everything? Oh, I'm from New York. That was it.
Awesome. I want to take your dance class.
Oh, I need an Advil.
Anyone else want to take a few moments to share? And don't be shy, we're all family here.
I'm Tammy Pilasek. I'm from the California Department of Public Health in Bay Area, Richmond, California, and I'm on your governing counselor team. Happy to be here and happy to have one of our policies passed this time on universal health care in light of COVID-19. So that I was on the authorship team and woot woot, we got it through.
Absolutely.
Congrats.
So, congratulations to you. And again, on behalf of our CHPPD leadership team, we welcome you. So the burning question a lot of people have, because we are so broad, is what exactly is CHPPD? It is formally known as the Community Health Planning and Policy Development Section, and we really influence the design of health systems and policies that are responsive to an ever-changing society. And I think we've really seen the breadth and depth of that during COVID-19. We absolutely bring together technical information and expertise from communities, our health professionals, businesses, and our government. And so just to give a little history about CHPPD, we are a young 52 years. Our section was formed in 1969. And so Richard H. Schlesinger was actually our founding chair. And it was originally called the Community Health Planning Section, and policy development was actually added to our name in 1990. So as you can see here, this is a picture of Richard. And I love this quote that was issued in the first newsletter, which I'll read, is that to some, it may seem like the establishment in November 1969 of a community health planning section was the swift response to the association to an idea currently fashionable. To others who had pressed for an organization of a section in 1960, it seemed like a long action overdue. To the handful of people who met yearly since 1943 at APHA and at the National Conference for Social Welfare to discuss the goals, methods, and hardships of health planning, and numbers of people now involved and pressing for section formation seems almost unbelievable. So here we are, 52 years later, doing amazing things. And another notable person from our section is Leona Baumgartner, and she was one of our first governing counselors. She also went on to become New York City Department of Health first woman commissioner. And so at the time we were formed, we were the 17th section, and we had 360 members. And so 52 years later, we have grown tremendously. Our mission is to develop and advocate for health planning policies and practices to promote health equity, community empowerment, and social justice. We also have a vision to be a dialogue and action nexus for community health and policy leaders. And so as you can see in our 52-year history, we've grown from 360 members to now over 3,800, active members. We have a global influence that spans 45 out of 50 states. We have a pretty good cross-reference here tonight, and 39 countries. And our longest active member actually joined before we were even a section in 1940. So again, you can see the breadth and depth, and as well as the commitment of members across our organization who are committed to uplifting the mission and vision of our section. And I'm so proud to be a member and to lead this section in the greatness that we accomplish every day in our professional space and what we advocate for as a part of the organization.
Wow.
And so I'm going to pause there, and that was it's a lot of information. One of the things that I think was really important for us, if any of you had an opportunity to join us for our business meetings, that we talked a lot about our history. We don't get an opportunity very often to look at the significant impacts that this section has had on helping to shape policy nationally, locally. Our very own Tammy told a very phenomenal story. I love if you can give some tenet to that again about, her time when she had just joined the organization. It was information that I didn't even know, and I was absolutely blown away. So I see you smiling, Tammy. So if you could just give us a little bit of tidbits of some CHPPD history, that would be phenomenal.
Well, one thing I didn't share at the business meeting was that Hendrik Blum was my mentor at UC Berkeley. He is known as the father of health planning, and I wondered whether he was ever part of the CHPPD section. I don't know. I know that he was one of the local health officers in the county in California where I now live. So I don't know whether it's possible to dig into the history at APHA and find that out. It might be interesting.
Oh, that's wonderful. But Tammy, can you share a little bit with us that story that you shared about when you
want me to tell that story?
It was so interesting.
So the year after I got out of graduate school, I think was the first year that I attended the APHA conference, 1986. So you all know that I'm really old. And it was in Las Vegas, and they had an event at the Nevada nuclear test site to protest nuclear testing. And the president of APHA was then Vic Seidel, who was a doctor as well as a renowned professor of public health. And the invited guest speaker was Carl Sagan, the astrophysicist. And so we had this incredible event where they bussed people out from the conference. And after this, whoever wanted to could get arrested. So a lot of people got arrested, including the president of APHA. And after that, many of us went and had a dinner with local activists who were working on the issue of nuclear peace and in the Nevada area, something similar to what we do in our Day of Action. And so I just thought that APHA was the greatest organization ever.
Thank you so much for that, Tammy. And you're absolutely right. We'll talk a little bit more about our Day of Action, but to hear stories like the one Tammy just shared is really inspiring, because it really centers home our values around social justice, and regardless if it's racial, if it's economic, if it's environmental. Because of the breadth and depth of our section, we have an opportunity to support wherever we feel injustices are. And so this is just one of many stories, really, and a testament to our support of just organizing, health equity, racial equity, you name it. We have the place, and as we call it, the nexus, to create that dialogue and to come up with actionable solutions and actually get out there in the community and to do something. So Tammy, thank you so much for sharing that story. Like I said, I was deeply moved. It's just, you learn something new every day. And with having over 38 members, you have 3,800 opportunities to learn something new. So for those of you that are very new to our section, I really encourage you to take a moment to get to know your fellow section members. You never know what you'll learn. Next, I want to talk about some of the highlights from 2021. Again, we, at the height of this year, we're still dealing with COVID in a very impactful way. And so I really just went out on a limb to say, despite of what we had going on, we had some phenomenal volunteers that pushed through personal situations and tragedies we've all faced, demands with work. But despite all of that, we still came together and we were able to put on a very phenomenal programming year for our section members. So I just want to take a few moments to highlight some of the great work that's happened over the last year. And so again, with our theme this year of creating social connectedness, I really feel like our section really embodied that over this last year. At the beginning of the year, we had an opportunity to salute our public health service corps. A lot of times when we think about veterans and when we think about the military, we don't think about our public health service corps. They are considered military. They play a very important role in the health and the safety of our nation. And so we're so very honored to have quite a few public health service corps members that are part of our section. And so some of them shared their public health service corps journey with us. And so I hope that this is a tradition that we can continue throughout the years, to be able to, one, uplift and recognize those who are really, they are on the front lines when it comes to emergency preparedness, when it comes to this work in the pandemic, when it just comes to the health and safety of the food that we eat, our water supply, so many things our public service health corps is responsible for. And so I was so excited to be able to just showcase just a glimpse of that work. We actually got a lot of response from students who wanted to learn more about joining the corps. So we built quite a network in doing that. Also in January, we had our first virtual town hall meeting. And so this gave us an opportunity to recap all of the great things that we did throughout the year, the great things that happened during the annual meeting, but we also talked a lot about some of the things that we wanted to do throughout the year. And section members had an opportunity to speak directly to our leadership team, to voice their opinions about what they wanted to see. And we were able to take those ideas back and to put together the robust program that you see before you today. So thank you to those who participated in our virtual town hall. One of the highlights of our year was actually our abstract writing workshop, which was curated by our student liaison, Deja Knight, who's on with us, as well as the student committee. This was actually a vision of hers to be able to provide some tips of the trade to help students to really make the most of the abstract writing experience. So we've had writers, reviewers, from all aspects of our section to come and just talk to folks about how they can put together the best abstract that they could. And I can say this year was by far one of the best scientific programs that we've had in terms of content, in terms of our speakers. And I will absolutely credit that to this workshop that we had to really prepare our section members for that. Every year we celebrate National Public Health Week, and this is the one time of year that the public health community actually works in the community to promote public health programming. So again, this is another activity that is solely led by our students and our student committee. So again, super shine to Deja Knight and our student committee for putting on a week's worth of activities. And I mean, it was jam-packed. We had a great webinar by our very own Tammy Pilasuk, who works on our public health communications working group. And with Deja Knight and the students planning anywhere from reading activities for young students. We had movie reviews, we had a fireside chat, we had so many activities. It was really a phenomenal time, and this happened during the first week of April. Another great moment for us was being able to support 11 of our section members to attend the APHA Policy Action Institute. And this is typically a 2-day event that's held in person that gives APHA members an opportunity to actually advocate on the Capitol. But we were still in the midst of a pandemic, so this event happened virtually. But from the responses that we got back from those who attended, it was very, very impactful. They learned a lot about how to create policy, how to actually advocate, and to meet with their local legislators. And so this is an event that APHA hosts every year, and we do hope that in the future we'll be able to support others who want to attend and learn more about public policy. And just to kind of round it out on some highlighting activities, this year we had our first ever mid-year meeting. Again, another one of my wish list items for this year as a way to engage our membership. And this was led by our chair-elect, Maurice Johnson, and our committee of our leadership team. And they did an absolutely phenomenal job of putting together a two-day meeting. I think what was most impactful about this meeting was that we had an opportunity to hear from our section members about their various aspects of work. And so we had some phenomenal speakers. We had an opportunity to do some guided meditation, and we had an opportunity to connect with one another where we would traditionally only reserve that for the annual meeting. So I want to give super kudos to the mid-year meeting planning committee. And again, this is another activity that we are hoping that we can continue in the future. So CHPPD, we call ourselves the best section, and we really are the best section. Next, I want to just take a few moments to talk about our annual meeting activities. Again, we wanted to ensure whether you were in person or virtually, you had an opportunity to connect with each and every one of us. So we had several member engagement opportunities from getting the most out of annual meeting and navigating that process. I know for me, going to the annual meeting in person is daunting because there's so much to do, so many activities, so many presentations. I personally like going to the expo hall. I feel that that's a great way. I love poster sessions, so I spend most of my time in the expo hall. But for those who love oral presentations, for those who love the meetings, it can be pretty overwhelming. So our immediate past chair, Dr. Brian Buckley, gave an amazing overview of how to navigate the meeting, whether it was about something as simple as bringing snacks with you, because I think we all forget that and are dying of starvation probably midway through, and really, maximizing this time to make the most of networking. I think this is probably one of the only meetings where you'll actually get to see sitting and past surgeon generals just walking down the hallway. And they're so open and amenable to talk to you, not just surgeon generals, but really juggernauts in the fields of public health. And so this is for all things, all of your wildest dreams in terms of what you want to do with your career and how you want to navigate. Our student liaison, Deja Knight, tells a beautiful story about how she was able to navigate from graduate school to now pursuing her PhD, all because of, tips from the trade from our section member on how to navigate and how to network. And so it's really important to make the most of your time while you're at the annual meeting. For those who were in Denver, we had 3 different opportunities for you to meet up and just to have informal conversation with section members. So I really appreciate the time that our governing counselors and our section counselors volunteered their time to actually talk to section members while we were here. We traditionally have our section business meeting again, and that's where we go over all of our activities for the year and talk a little bit about what we want to do in the incoming year. We also do the same thing with our student and new member meetings. For the past 11 years, we have done a day of action, and this is led by our very own past chair, Amy Carroll Scott. And so this is an opportunity for us to step away from the conference and actually connect to the local community and to hear more from the community about issues that are very pressing to them. This year, we had the pleasure of working with the Colorado Public Health Association and learning more about their issues around public health for public safety. And so for those who were able to attend, it was absolutely amazing. We had about 171 people to register with 72 active participants. And we heard some very phenomenal stories around violence prevention, firsthand accounts around what our public health professionals in Colorado are doing to advance health equity and racial equity here in the state. And so I was simply blown away by the stories and by the work. And so those who attended, I do see some head nods, were truly inspired by the work that's happening here in Colorado. So I certainly want to give a huge shout out to Dr. Amy Carroll Scott, Raga, and the rest of the planning committee for all of your work that you did for the day of action. Something new to us that I hope that we can continue in future is that we had our first ever virtual coffee hour. And this was so much fun. We had an opportunity to actually hear from a barista, and she shared her story of coffee and really shared how coffee is used as a symbol of connectedness and how that's important. And we were able to translate that to our theme of strengthening our social connectedness around public health issues. So for those who were in attendance can attest that we had a very great conversation, one, learning more about coffee and baristas and how that business works and how it really helps to really serve as a bridge for any and everything that you want to do, but also just having an opportunity to connect with one another. I think we're having such a good time that we forgot what time was and we got cut out of the meeting. So again, I really do hope that APHA as an organization will continue to keep these engagement opportunities available to us throughout the meeting. But what it also showed us is that we need to curate more opportunities throughout the meeting themselves within our own section to kind of bridge that gap so that we don't spend too much time not connected to one another. So I'll pause there just to see if anyone who had an opportunity to attend any of these events would like to give gratis or to share a few words on your experiences. I'm going to pick on Whitney because she's our social media person, so she could share more about our activities. I think you're still on mute, Whitney.
There we are. I was like, where's my button? Gosh, I mean, we did so much this year. I think it was definitely a bigger change, which I actually like. I think From a social aspect, we've all been isolated for a long time, and sometimes we're isolated from our colleagues and family and friends. And so since you guys are all kind of the same for being CHPPD members, it was nice to be able to socialize with you. I would say that the response online has been great. We've been tagged in a lot. We've been responding a lot. We've had a lot of new followers. I don't know if that's from our outreach or if they've like seen us online. They're like, we're going to follow these crazy people. And yeah, so there's been a lot of response. Brian just emailed me this afternoon saying that he's verbally heard it from people when he was walking around the facility. So it's been great. I think probably our biggest response was during Day of Action in the virtual coffee hour. Everyone was kind of online sharing the information, which is kind of what we want to do. We want this to be for members, but also, to show what we're doing, what we support. I think people who are not attending APHA were able to kind of gather on that. I actually did a poll online about when did you first start drinking coffee? And one man was like, back in my day, when he said that he's in the 70s or his 80s, he says that it actually was appropriate for kids to drink coffee. And I didn't know that. He said a 12-year-old. And I was like, that is just a whole nother level of public health programming right there. I was like, oh my gosh. I was like, you're having caffeine that young? So it was just really nice to kind of see that even though people are not here, they can still engage. And I hope that social media can look different in the future. I attended a one-on-one virtual consult with JSI, and we have a lot of good ideas for how we're going to engage more. And I would like to see more of the virtual coffee hour and things like Day of Action. I think we're all a little Zoom fatigued with slideshows, not this slideshow, but other slideshows that we have to do for work. But we want to see more engagement and stuff. And even with the coffee hour, we saw how it related so closely with what we do and how we engage with each other and our public, and kind of encourage us to kind of move past this COVID time and be better people and communicate better with people, especially with the service industry. So yeah, I think it was a great year. I think we had a really great APHA year.
Thank you, Whitney, so much. And I want to open it up again. If there's anyone else who would like to post any comments, I'll also check the chat to see if there's any responses. And Deja Knight, she noted that she learned the power of using Twitter to network from CHPPD. Raga thanks everyone for uplifting the events and accomplishments this year. And she wanted to give a special shout out to Whitney. She has been absolutely a lighthouse for us in terms of our social media presence. We've definitely grown as a section because of the power of our social media. So I want to always thank her. I think I overthink her sometimes, but it's a lot. And we just thank you for your commitment and your dedication to our section. So. Next, I want to talk a little bit about fundraising. Fundraising is absolutely the cornerstone to the success of our section. We do fundraising year round, and what fundraising does is it ensures that students, our early career professionals, and some of our professionals have the opportunity to come to the annual meeting where otherwise they would not have that opportunity. And so we absolutely have seen the power of what fundraising can do. And I can certainly tell you, as a scholarship recipient in 2018, and I believe that was our San Diego conference, I know I absolutely would not have been able to make it to San Diego. Our West Coast conferences are a little bit more expensive than our conferences in the Midwest and on the East Coast, but that was absolutely a lifeline for me to be able to receive a scholarship to help pay not only for my registration, but it helped to cover some of my costs while I was there. And so this year, APHA has made that a little bit easier for us to do donations. Normally during our business meeting, which is in person, we do an ask for donations, and we can typically do that in person. Given our virtual status, we now have a nifty QR code that we can use to do donations. This year, we have a goal to raise $2,021, and that equates to our ask of our members to donate $20.21. And we do highly ask that you consider donating to our section. It does support our activities and scholarships for our section members. And it is pretty easy to do. You can actually go directly on our website. We are still offering prizes to be in a raffle for those who do donate. Our fundraising chair is Josephina Frankovich. She is not able to join us today, but she does send her regards, and she has been an absolute lighthouse to us as well in terms of curating our scholarship process. And so every year we go through a formal process to select our scholarship winners. We actually have a process where we have section members who actually read scholarship applications, score them, and select the scholarship recipients. So we absolutely do our due diligence. Our scholarship recipients also have to volunteer and participate in our section activities and give a report out of their what are their greatest takeaways from our conference. So we make sure that we use your funds exactly the way that you intended. We are faithful stewards of donations. And so again, we ask that you take a picture of the QR code. This will also be available after the meeting today, but we are actively working towards meeting this goal of $2,021 by the end of December. So please, if you can, consider donating to our section.
And the link to the fundraising is also on the chat.
Thank you, Maurice. So now this is my favorite part of the program. I'd like to take a few moments to recognize the hard work that our colleagues have done in the field of public health, our leadership team, and other notable contributions to this section. Traditionally, we would start off with our Bloom and Vision Awards, but this year we like to take a moment and recognize our section members who really served on the front lines this year and in 2020 during the height of the pandemic. And so we have a small video presentation that we'd like to share with you. So let's take a moment to give a huge round of applause to all of our section members for the phenomenal work that they have done over the past, I feel like 15 years, but 18 to 20 months to really help us to combat COVID-19. Again, I can attest that this has been a strain on all of us, whether it be professionally, personally, socially. And so it wouldn't be remiss if we didn't take an opportunity to uplift those who have made such a significant contribution to this pandemic. And so we want to be able to honor that and to archive that as a part of our history and our contribution as a section. So thank you. Next, I'm going to turn it over to, turn it over to Raga, who is actually the co-chair for our awards and recognition program. And she's going to talk to you a little bit more about our Bloom and our Health Planning Award, and as well as some of the other awards that we have for this evening. Raga, the floor is yours.
Thanks so much, Ebony. And thanks again to all of the people who were featured in the video, and also to just everyone in the section for all of your contributions to public health now more than ever. So now it's my great honor to present the Henrik L. Blum Award for Excellence in Health Planning. And Lou is unfortunately not able to join us today, but I wanted to quickly read a little bit of her bio just so that you can hear a little bit more about her. And then she also shared a video with us, so we can play that afterwards to hear a little bit more about her research. So Lu Shi is a health management and policy researcher working to improve healthcare access. She received her BA in management from the Southern Medical University in China and an MPH in health management and policy from Tulane University. She's currently a PhD candidate from Oregon State University, and her research focuses on community healthcare, health equity, pharmaceutical, economic, chronic disease management, and cancer care. So for her PhD thesis, she conducted analysis on disparities in healthcare access among patients with liver diseases. And based on her research, she was able to make some policy recommendations, which was commended in her nomination. So Ebony, would you mind playing the video so we can hear a little bit from Lou? Ebony, I'm not able to hear the video.
Sorry about that. Let me start it over.
No worries. So much.
Hi, everyone. My name is Lucy, a PhD student from Oregon State University. Thank you so much for getting me this award, and thanks to the committee
I might be
to give me this opportunity to present my key learning. I just want to briefly introduce the project I participated 2 years ago. In 2019, I cooperated with the district-level centers for disease control and prevention in Shenzhen in China to conduct a community-based survey research. The research is concentrated on several perspectives: utilizations of community healthcare center, awareness and utilization of family doctor in the community, physical activity of residents, and chronic disease management. The uniqueness of this community-based research is this community introduced integrated healthcare system to organize community healthcare resource. This research is the first research to evaluate the integrated healthcare system. Some key lessons I have learned from this study is the residents living in the community is less likely to use community healthcare centers resource. The trust of primary physician is low. The awareness of chronic disease management is low in the community. Therefore, It is important to advertise the healthcare services provided by the community care centers and the primary physicians. Efforts to increase the satisfaction in community healthcare centers can increase utilization and the health outcome of the residents. Also, more qualitative research will be conducted to identify the reasons that cause the untrust of community healthcare centers. Thank you so much again for listening. Hi, everyone.
All right, and then we're gonna go to
Our next award,
Hi.
which is the Vision Award for Excellence in Health Policy. So first I'll share a little bit from Dr. Dutta's biography, and then we'll turn it over to Dr. Dutta to say a few words. So Dr. ChpppD Dutta is a social scientist and inclusion strategist in public health with 25 years of blended experience in research, teaching, and service, including her widely viewed TEDx talk. Currently, she's an assistant professor at Fort Lewis College, a Native American serving non-tribal institution in Colorado. Here, alongside teaching upper level undergraduate courses, she mentors students' internships. A self-described pracademic, Dr. Dutta has public health practice and research experience, typified by program management, grant writing, policy research, and advocacy for large-scale multi-country programs to make effective biomedical prevention tools among marginalized populations. Her body of published work, webinars, and community radio presentations reiterates fostering subpopulation-based, equity-focused community engagement models, especially among rural and indigenous populations, for improved health outcomes and empowered relationships between communities and health systems. So with that, I'll turn it over to Dr. Dutta to say a few words, and congratulations.
Hey, thank you so much. And I'm actually sitting, I don't know if you're able to so here is the award, and sorry, it's too transparent, so possibly you're not able to see it, but it's lovely to hold it in real while we are having this virtual award ceremony. So part of it, as so many of you mentioned, yes, we did miss out on, and this is my first year that I have not attended the APHA in person. So absolutely missing it. But of course, the good part or the brighter side of it is so many non-members, which include so many of my students who are able to participate in it. So yay to all my students who are out here. As you heard, it is a non-tribal serving Native American institution in Durango, Colorado. So we have faced the hardest of disparities in terms of internet connectivity, COVID-related incidents, prevalence, and also vaccination inequities. So I again salute all of course, professionals, all of us who do know have a flavor of conferences, but a big shout out again to so many of the students, because I myself began my first APHA as a student, and I know that I couldn't, I was like, my travel was all dependent on the scholarship which I got from my advisor. So virtually having it actually has allowed so many students and non-APHA members to participate in this event, and possibly so many sessions also. I would say October also is a very special month, because a couple of days back, many of you know that we've celebrated the World Polio Day. And as I was also looking into so many of the award winners and women award winners working with minority populations, Malala's shooting also had happened in the month of October, 9th of October. So again, this month is very special to me as a woman of color, a woman coming from a different country, a woman who has began her education at a very non-traditional age. I signed off my PhD when I was exactly 41, and I actually have no problems sharing my age as far as that goes. I actually take it as such a huge compliment. I began as my discipline as a social with social work, studying social work in India, and then participated research in Netherlands. Thereafter, I came to the US to do my PhD, and trust me, when I was wanting to do, and my background has been very program oriented with nonprofits, and then so as I was formulating my research question around community engagement for uptake of prevention tools, I was actually very unsure that would be even accepted as a PhD topic in a public health school. So I think this is a huge fora, or this is a great fora, which actually talks of those linkages between community health and policy, because that is all, that has been more of a intervention, the discourse which we had been having, rather than a research or an academia discourse which we had, if I may say so. Another thing, coming from a very small little city in India, and now being in a small place, teaching students, most of who belong to Native American and other indigenous groups, I would say just belonging to a small place in itself often inhibits their right to dream, which, and I think at some point we need to feature it as a social determinant of health, the right to dream in itself, because that in itself carves out our academic research and practice trajectory. I would just like to say three things which has driven me all through, three little words. My work in Africa, which talks mostly about the essence of Ubuntu, you are and that's how I am, the connectedness, the solidarity. Insia, a word which is like not India, but a D instead, a S instead of a D. And Insia in itself means humanity. And I think COVID has actually taught us how connected we have to be. Solidarity, from clinical trials to vaccine research to distribution to understanding lives and livelihoods and health, all of it put together. INSIA is the other word. And the third word is the approach of One Health. And One Health, if as long as that is not the approach, I guess we would fall back, or the health outcomes would or the disparities would remain as long as we do not appreciate nature. Recently, we just had the UN Governing Assembly, UNGA meet, and I think all the global leaders were talking about aspects of climate change as much as they were talking about COVID and health-related aspects. I would just end with three words which have driven my work. But unfortunately, as you would type them in a word, you would see the red swiggy or the swiggy underline, which means that they are still wrong words. So these three words, one is intersectionalities. We have talked so much about it in public health, but type it in a Word document, it will still show that it is a wrong word. A word called prac academic, which I come from the practical world, and I try to stitch between what I have learned from the field, from my communities of research, and build into my academic research. And I still define myself as a prac academician. Again, type it out, that's a wrong word. And the third and the most important word is glocal, a global approach with a local thrust or a community-based thrust, which is, I think, a very big ethos of CHPPD. Again, type it out, global is again a wrong word. So I guess I was so amused to realize that possibly I'm doing all the right things, but possibly grappling around with many such wrong words. So social construction of these words are very important. And I am telling this with a very serious note, because some of many of my many of the languages I have seen that gender, there is no proper translation even of the word gender, and it's just written in that dialect. So possibly a time when we actually think of these words seriously, build it into the verbatim or the vernacular of public health and community health per se, and possibly more and more of such kind of awards, I think is a huge impetus, of course, as many of us realize, but of course is a great punctuation for us to stop and think and reflect and internalize how much we have done, but how much is yet left to be done. I would just like to end thanking again the CHPPD team, APHA once again, of course, missing you, huge hugs, and shout out to all of you out there, my family and friends in India who have actually woken up 5:36 in the morning to listen to this call, and many friends out there in East Coast for whom it's almost close to like past dinner time, who are still attending this call just because they have not just love and faith on me, but the kind of work which we are doing. So thank you so much once again.
Thank you so much for that. Your speech was so inspiring. And I think, again, our perceptions are our reality. So I'm so glad that you lifted up the notion of dreaming, because we often misplace that. I think a lot of our attributions to where we are today as public health professionals is because somebody believed in a dream that we had and they were willing to lend not only a handout, but a hand up. So thank you so much for everything that you do as a practitioner, as an academic, as a mentor, and as a contributor to health policy and planning. We love you.
So much.
Okay, Raga, here you go.
I echo everything that you just said, Ebony. Thanks so much for those inspiring words, Dr. Gupta. Next, it's my great honor to introduce Dr. Jessica Thompson. As a recent graduate of the University of Pittsburgh Graduate School of Public Health doctoral program, Dr. Thompson is currently a postdoctoral scholar with the University of Kentucky Markey Center for the Cancer Center Community Impact Office. With a background in community-based research, including a master's degree in community development and action at Vanderbilt, her research focuses on community-engaged approaches, chronic disease prevention, rural and Appalachian women's health, and systems science. So it's my great honor to present Dr. Thompson with the Best Doctoral Level Abstract Award, and would love to turn it over to you, Dr. Thompson, if you'd like to say a few words.
Oh, sure. Thank you. And thank you all for this award. It was such a surprise and such an honor. I guess just quickly, just do some thank yous first off the gate, of course, to everyone who had a part in giving me this award. Thank you. Also, this was part of my dissertation work. So certainly, I think many of the other PhD students here or recent graduates can relate to how challenging it has been transitioning to what learning is like in this new life that we're living. So that certainly was a big transition for me. I was in the midst of my dissertation work when everything started happening, and suddenly having to adjust my plans and all that entailed. It certainly was a process. So to my dissertation chair, Jessie Burke, who is right by my side, helping me work through all of that, and the rest of my committee members, a big thank you. I also had a fantastic master's student at the University of Pittsburgh as well. Her name is Lindsay Pelcher. She really helped support a lot of my dissertation work. As you've heard, I am a community engaged researcher, so that was another learning experience as well. I think a lot of us who do work out in the community, what does it actually look like when you can't be out in the community? So I think I was really pleased with not only some of the presentations I've actually heard throughout APHA, but in my own work, learning a lot about how do we do that? What are some other strategies that we can utilize? And so I was really happy to be able to share some of the work that I did that I was able to do remotely in this new world we're in. So I'm happy I was able to share that with some of you all this past couple of days in my presentation. So just to give you a little bit of context, I do work that focuses on chronic disease prevention among women in the Appalachian region. Oh, it's late here. And so I definitely learned a lot using a method called concept mapping, which I love, which is a participatory mixed method. So I'm happy to share that with others and just sort of spread the word about that wonderful method I was able to use, as well as some of the findings in terms of the real struggles that people in a lot of rural communities are facing when it comes to access, and certainly doing this amidst a pandemic where some of those were even further exacerbated. So I appreciate even the space here to share a bit about what that's like and the health equity issues that exist for women in Appalachia. And yeah, I appreciate this so much. Thank you all for this award.
Thank you and congratulations. We really appreciate you sharing a little bit about your work, and we wish you all the best in your future endeavors.
Thank you so much.
You're welcome. Okay, Raga.
And last but definitely not least, for this section of the awards, we have Shauna Hodge, who earned the Best Master's Level Abstract Award. So unfortunately, Shauna was not able to make it, but she did send a few words that she'd like me to share. So I'm going to first read it a quick biography and then also share those words with you all. So Shauna Hodge is from the eternal Alaskan village of Klukwan. Shauna attended Shemawa Indian Boarding School for high school, which led her to develop a desire to improve tribal communities by fighting systemic inequities. Shauna is a recent graduate from the North Dakota State University Masters of Public Health program, and all of her educational pursuits continually led to tribal and federal policy and their impacts on Native American health. And she is currently enrolled in the Masters of Rural Community Development program at the university and works at the Chilkat Indian village of Klukwan as the tribal COVID liaison, where she works directly with federal coronavirus relief effort acts that inspired her poster presentation project, for which she received the award. So here are some of the words that she shared in her reflections on the work that she presented. As a Native American person growing up, everything is community-centered. We are a product of the generations before and after us. Right now, it seems like traditional views in America are rights-based. The tribal nations are obligation-focused. We have an obligation to our past, our present, and our future. I have always felt that. I was always the one to ask why. So when I went to an Indian boarding high school, I asked why. Why are so many of my friends scared to go home during the summer? A lot of them didn't have a roof over their heads, 3 meals a day, or a safe living environment. They lived in fear that they wouldn't survive the summer. Why were so many of my friends dropping out of school? No one was there to push them, to care for them, to love them. And when I graduated, the question shifted. Why are so many of my friends dying? Many of them died by suicide, overdose, vehicular accidents, gang violence, or even becoming one of thousands of missing and murdered Indigenous people. When I became a mother, my questions turned to why aren't Native Americans featured in the PREMS survey? Why are Native people grouped into the other category? Why isn't breastfeeding supported by workplaces? Why aren't people talking about the impacts of historical trauma on breastfeeding success rates? The more I began asking why, the same demographic information kept coming up as a predisposing factor for our chance at a quality of life. Whether your parents are married, what your parents' education attainment is, what your family history is, what your household income is, whether you have access to a working vehicle, etc. Things that were out of the control of an individual have the most impact on our health. It's the system that the United States has created for us. That's when I began seeing public health as a system. Today, I accept the award for reading levels and literacy, important considerations for the federal relief acts related to COVID-19 for tribal nations. This research highlights yet another example of the system failing to remember whom its audience is. And because of that, we pay for it, sometimes with our lives. We deserve a better system. Public health inspires me to continue to finding answers to the big question, why?
Thank you so much for that. I think, again, when listening to Dr. Tapati and Tashana, again, you can see the breadth and depth of what we do every day as public health practitioners. And we're so honored to be able to, one, celebrate your work that you do, and then just highlight the diversity within our work field. So again, to all of our award recipients, thank you so much for your contributions to public health. We're not done. I feel like, Oprah, you get a Cadillac, you get a Cadillac, you get a Cadillac. Next, we're going to go into our CHPPD Leadership Awards. And this is an opportunity for our broader section members to learn more about the great work that our leaders do who are volunteers. We don't get paid. This is truly a labor of love for us. And so every year we take a moment to highlight a few of our leaders who have done above and beyond in terms of the work that we do for the section. So our first award goes to our very own Caitlin Esposito, Excellence in Collaboration. Caitlin serves as our membership co-chair. And when I say lighthouse and glue, she has absolutely been the glue to a lot of the programming that we have had this year. She works so diligently across all of our different working committees, and we would not be where we are today if it is not for Caitlin working behind the scenes. So we just want to take a moment to say, thank you so much for your contributions, and we love you. And this section is grateful to have you as one of the members. So thank you.
Thank you, everyone. Thank you. I have my thing here. I just put it over here.
Next, we have excellence in member engagement, and this goes to our very own Deja Knight. Deja, as the student liaison, has been an absolute rock star. Again, she has done so much to promote and craft engagement activities that have not only been beneficial for our students, but we really feel it's been beneficial to the section as a whole. And so again, she is one of our very own success stories, starting as an MPH student, volunteering with the committee. Then she became our student liaison, has done a phenomenal job in this space, and she will be moving on to be one of our section counselors. So again, Deja, we thank you so much for all of your hard work and your contribution to this section, and we love you. Everybody,
thank you.
Round of applause to Deja.
Thank you, everyone. I feel like I grew up in this section, and I'll continue growing up as I move on. So thank you.
Next, we have our very own Brandon Brooks, excellent in policy engagement. And so Brandon is actually one of our governing counselors, and we needed to make a transition in terms of who our policy chairs were. Brandon absolutely stepped in at a very critical time. For those who don't know, our policy committee works very diligently throughout the year, one, reviewing policies that are being voted on through the APHA Governing Council, but two, he also organizes who will be attending at the annual meeting, which governing counselors will be on deck. If they're not on deck, he organizes proxies. So it's a lot of moving parts. And so again, in the midst of COVID, his very important work that he does at the Department of Health and Hygiene for New York State, and being a student, he has been such a light to us. And so again, we just thank you for your time and your dedication and your work in our policy area. So thank you, Brandon.
Thank you. I really appreciate it. And I do apologize for being late. I actually just finished taking my midterm, as you just said. So I want to make sure I stop by and just say hello and thank you for the award.
Oh, you're so welcome. Last but certainly not least is our chair citation, and this is one of our highest honors. This year, we are awarding our very own chair-elect, Maurice Johnson. A little fun fact, he is actually my APHA mentor. When I first came to the section, he was the first person to greet me as chair of the membership committee. And I said, hey, I want to get involved. He was like, okay, well, I'm going to give you these things. And so here we are. It is 2021. So 6 years later, you know, through various activities, growing within our membership committee, serving as chair-elect, and now serving as chair. I absolutely would not be here without the encouragement and the support of Maurice, but it is not about me. It is about the work that he absolutely does behind the scenes to ensure that all of our programming, whether it's our nominations, whether it's recruiting new members to serve in leadership positions, his organizing our mid-year meeting. On top of that, he is also a student too, and a husband and a father. So many things that are happening in his personal space, but he still takes the time to show up and to be present and to support our section and represent us in such a way. And so these are the things that we really hold true to us. And we want to say, Maurice, thank you so much for your dedication, not only to our section and this organization, and we love you. And thank you so much for all that you do.
Thank you all. As Deja said, I have grown up in this section and professionally, personally and all, and I really appreciate all the work that this section has allowed me to do, practice my leadership and my professional development skills, networking skills. And so it's a love, it's a passion. I don't see myself leaving this anytime soon. I hope to be in Tammy's shoes in 5 years because I'm just behind her. No, she's only, 5 years young. And I do have my award, so thank you. Ebony says that I am her mentor, but I will say the student has become the teacher, and I appreciate her for her leadership of this section. And I'm just glad I'm here to help support, and she's providing me guidance. So when I step into that role, I know her, and we have so many leaders who have guided us throughout this past. I joined when Amy was the chair of this section years ago. Went from Winston to Padma to Brian to and I said Ashley and now Ebony, and it's just been a great stewardship throughout this section of leadership all these years, and I'm hoping to help guide in the years coming. And thank you, Ebony, for all your leadership. Thank you to all our leaders in this section, because it really is, we're all doing it as a volunteer effort. And so it really is amazing to see all the things we accomplished as a section. And thank you to all our members for contributing and giving back and sharing the work that you do, and just keep moving forward. Thank you.
Thank you so much. Next, we would like to just acknowledge our travel scholarships again. So your fundraising, your donations really do come back full circle. This year, we were able to award quite a few travel scholarships. I'm so excited to announce that we had a lot of students this year we were able to support both virtually and in person, as well as our early career professionals and our professionals. This year, we awarded more than $3,600 in scholarships to our section members. And again, this goes back to the tremendous support that you all give as a section. So again, your dollars matter, they stay within our section, and it really does support the professional development of our section members. So again, if you can contribute, we ask that you do. If you are wanting to attend an annual meeting and can't, we encourage you to please apply for our travel scholarships. We usually do our announcement for applications in the spring. Again, I can't say enough about the travel scholarship. Again, like I said, as a personal testament, it changed the trajectory of how I volunteer with this organization. I truly know the value of it, and I hope that you see that in this program today through our award winners, and then also through our travel scholarship recipients. So thank you all so much for attending, and we look forward to hearing all of the wonderful things that you've learned during this annual meeting. Last but certainly not least, I am super, super excited about our CHPPD representation in APHA. We don't get an opportunity to talk about how our section members are actually progressing through the organization. I am so happy to announce that one, we have Dr. April Brown from Michigan, who has been appointed as vice chair of the science committee. And the science committee really works to ensure that what we produce is of quality, it is sound, and it is researched. And so during this next year, she will actually serve as a part of the Joint Policy Committee. And so that is the committee that actually does the review on all of the great policies that the organization advocates for, not only on a local level, but nationally. So huge congratulations to Dr. April Brown. She's been a longstanding member of our section, and we're so proud of your accomplishments. We are also, let me get my little spirit palms together, excited to announce that our very own Dr. Brian Buckley was elected yesterday to be on the APHA Executive Board. This is huge. So he was unable to be here tonight. He's actually traveling back to Maryland, but he will serve 4 years as a representative of our section on the executive board. So he will be advocating for things not only that's important to us as a section, but will be important to the organization. And we cannot be more proud of this accomplishment. This election season was pretty intense. And so we've got to see firsthand what it's like for candidates to kind of travel on that path. So again, a huge round of applause for Dr. Buckley and all of his hard work into getting this board appointment. Tammy mentioned this a little bit earlier, but we also want to give another round of applause to Tammy and her writing team for the passing of the policy B6, which was voted in as a policy that APHA will advocate for the next couple of years. And it's on universal health care in the midst of a pandemic response. And so what this policy hopes to do is to set a precedent for what universal care would look like in the times of emergency management, not only for a pandemic, but a federal response, but just how we look at universal health care as a whole. And so her contributors went through quite a review and edit process to get here. It was a late breaker in last year's session, which means it was submitted after the traditional policy process. And we are so thrilled that it was approved by not only the JPC, but by our governing council. So congratulations again to Tammy and her team for a phenomenal job in writing this policy and for it being passed in our governing council this year.
Thank you.
You're welcome. And so that concludes our award ceremony. Like I said, it was jam-packed. We have a lot to celebrate. I cannot put words together on how exciting this annual meeting was for us as a section. We had so much to celebrate. Again, we want to make sure that you're following us on social media. And so CHPPD has a huge social media presence. We're on Twitter, Instagram, LinkedIn, and YouTube. So please, if you have not followed or joined our groups, here's the information. We also make this slideshow available after this programming in the coming weeks so that you can review this again and follow us on social media. We want to hear your stories. We want to support what you're doing, and we want to always share with you what we are doing as a section. So with that,